Welcome to Evening Rounds, a podcast that takes you behind the scenes in medicine. Tonight, we're joined by married physicians Martin and Heather Hofmann, sharing how they juggle parenting and the practice of medicine. If you like what you hear, please subscribe. Kelsey, we're doing something new.
Yep.
We have two guests, two for the price of one, both physicians here at Loma Linda University Health. Mr. Dr. Martin Hofmann, surgical urologist, and Mrs. Dr. Heather Hofmann, a hospitalist here at our Trosh Medical Campus.
Welcome, two of you at the same time.
Thank you for letting us be here.
We're excited to be here.
There's a lot of things we want to cover tonight, but the most burning question I have as a fellow dog lover and owner is you got two golden retrievers and you're both working as docs. So who lets the dogs out?
I wish we could say we have a whole team for that, but I think it's just it's a day-to-day discussion that we work out.
Yeah, lots of planning, lots and lots of planning.
Yeah, and I think that's part of it's being lucky of being here is on certain days I do have the occasion to maybe zip home in between patients or cases maybe for 5 minutes to let them out, but we figure it out and they're happy. They're good dogs too.
Well, retrievers are awesome, but they 8 or 9 or 10 hours is a long time to hold a bladder. So
yeah,
true.
Well, and that's a personal subject of mine. I make sure we never let them go so long.
You feel strongly about that.
Hydronephrosis or anything like that.
Absolutely.
That's that. One thing on that, I almost went into urology.
Did you?
I did. So I was cardiology all the way through until I did my urology surgery elective. I came home one evening and I said, Tammy, my wife, I think I want to do urology. And she's, why? They have the best jokes. and it wasn't just the jokes. It was actually just the camaraderie that the urology group had. And then I just had, more reflection and said, no, I can't. I'm a cardiologist at heart. Let's continue that path. But I couldn't resist that when he said, well, of course the bladder. I mean, we got to address the bladder for a dog.
So are you saying that cardiologists aren't funny?
No, generally we're not.
but we do need our cardiologists to be serious, though, in all honesty.
Is that how it needs to be? Good stuff. It's good to know. Speaking of consults, you guys have a very unique relationship because you oftentimes cross paths in what you're doing here for our hospital. Tell us a little bit about that.
Well, I would say, I like to think of myself sometimes as an ambassador to internal medicine and vice versa. I think as a resident, oftentimes any discussions or any friction would end up on our discussion table because we could kind of help cross those paths. But yeah, it's interesting being in the hospital, and if there's a patient who has a urologic issue, I may be the first curbside question, away, just a simple text message. And same thing, if I have a patient who has a medical issue, I have someone who I can easily ask for some advice, or at least help me phrase a question that an internal medicine doctor will respond really well to.
So, Heather, you're a hospitalist.
Yeah, so I'm an internal medicine physician, an adult doctor with a hospital-based practice, so I'm a hospitalist. We sort of have an identity crisis. Nobody really knows what a hospitalist is.
Well, tell us.
Yeah. No. Well, it's kind of weird because we're like 20 years old, but in medicine, that's quite young.
Yeah.
But I don't see patients in clinic. I see people when they're sick, essentially when the prevention doesn't work. All my patients end up in a gown, and I don't always know their background, but here they are, and they don't necessarily even want to be here. Yeah. So it's kind of troubleshooting all of that. And even going back to what you were talking about, Martin, of this consultant relationship, sometimes it's just the world of surgery and the operating room and an anesthesiologist team, and the pre-op, post-op is foreign to me in the hospital beds that my patients are in. So it just kind of opens my eyes to that other side of what patients are experiencing.
That's so cool that you guys can lean on each other in that way and see each other's strengths in your specific areas. I want to kind of back us up. Tell us about the start. Where did you guys meet, and how did this crew come together?
Oh, you're going deep.
I want to know. I want to know the history.
I feel a lot of pressure. I guess we actually go all the way back to high school.
High school.
So I was a junior in high school, doing really, really cool stuff. I was a journalism student, which is obviously the coolest kids on
I
campus.
respect you for this. This is also one of my fields. That's great.
And a lot of my friends, in that class were friends with Heather. And it was just through them that I realized this person's really kind of cool and special. And our relationship fostered there.
Yeah.
No kidding.
So are you a writer as well?
I mean, now I am because a doctor. We write a lot of notes. But all my friends were in journalism, and I thought, wow, he's pretty cool. One of my friends should date him. And then I don't know, it just sort of evolved over time.
Yeah.
So did you date in high school or no?
Yeah.
Technically, yes.
All right.
Yeah.
My goodness.
Wow. High school sweethearts.
Yeah.
And then how
awesome.
did that inform where you guys decided to do undergrad?
So I was a senior at the time, and
Let's go back.
sorry, yeah.
So you were dating a senior.
Yeah.
His nickname in the group is Baby by default.
Oh,
Not to imply anything, but here we are.
That's awesome.
I love this.
So you were going off to college first.
Yeah. We had both been interested, I think, both of us, because we had shadowed and everything.
Yeah, I think we both had an interest in science and medicine, and we're both kind of trying to navigate that question of exactly, do I want to be a doctor? Do I want to be a teacher? What, all that can come out of those interests.
Yeah.
And I had the fortunate benefit of kind of being able to watch what you were going through, and that informed a lot of what I did too.
And we both have older siblings, so we kind of knew there was a path to exploring your interests, getting a degree. And so I had gone to UC San Diego and still in Southern California, and stayed friends over that time, talked a lot by phone. Old school.
Yeah, of course.
Remember when we used to do that? Call each other.
And I think that really built our relationship back then.
That's cool. Gives that foundation. Huh? So you both have raised your wrists, and you have
yeah.
some cool, wrist bracelets there.
Yeah,
we
so
do.
our daughters, they heard what we were doing today, and they were really excited, and they heard the name of this, Evening Rounds, and so they wanted us to bring a gift for each of you.
Oh my goodness.
Which are some friendship bracelets.
So Kelsey, yours is a sparkle rainbow of evening, and Dr. Hilliard, yours is perfect palette of the colors of the sunset, and certainly with a smile on them as well.
And that's how I identify. I love this.
This is
the
amazing,
coolest thing
right?
we've ever received. Thank you to your daughters who handmade these bracelets for us.
They got some skill.
Oh, it's so incredible.
So obviously, you're not just professionals, you're parents.
Yes.
Which is obviously probably the most important thing that we
Yeah.
do.
And a full-time job.
Maybe over the dogs a little bit, perhaps.
Well, no, they're parents of dogs too.
Exactly, that's
important.
included.
Balancing a lot.
So tell us about your daughters.
Yeah.
Well, we have two daughters, 7 and 9. They're in elementary school. And they are so loving and similar and also so different, which is, I think, eye-opening as a parent. We had our first when as we think of our time in training, we ultimately continued on different years in our training. And I was first year attending when I had her, and Martin was a first year resident.
I was an intern on general surgery.
That was so our experience as a parent is sort of
Very different.
just full-time jobs.
Yes. How do you balance all that?
I don't know.
Yeah, I think it's always a work in progress, and I think it's just a lot of what we do in medicine, And this is any parent can admit that any success is built off of communication, patience, improvisational skills, and flexibility, and making sure you take time and you give each other grace and you just work through it, and then of course you learn every day how to hopefully do better the next.
Yeah. You guys must have the most wild color-coded Google calendar of all time, I'm imagining.
How did you know?
Because I feel that way, and I am not also practicing medicine at the same time my husband is. And so I feel like there has to be so much coordination in general, but the two of you and the schedules and the patient loads and just the timing. I mean, being in the OR, I can imagine being in a hospital shift. I mean, and a lot of times I'm sure you get held up and you're there for a lot later than you expect. At least that's my experience with my husband.
Yeah.
I imagine that is a lot of coordination.
Yeah.
It's a lot of coordination for sure. And I think a lot of luck. But I also hope that it's for their benefit. But admittedly, our two girls are really good at making calendars.
You taught them the skills.
So
That's great.
So I think they're learning some valuable time management skills and planning skills, which is mostly Heather's, forte.
That's great. That's great.
Well, we all need an internist.
Well,
Ooh,
and
well said.
I want to talk a little bit about that. We haven't had a hospitalist on as a guest, and we talk about how important relationships are with our patients, and we think of that often over a much longer longitudinal period than a hospital stay. I look at hospitalists as really the general managers, the meat and potatoes, whatever you want to call it, in terms of, as someone running a hospital, you need really, really great hospitalist teams and critical care teams, right? They're the ones managing the vast majority of the patients. In our hospital, we have our acute care surgery program too. I want to understand from you where you find your meaning in taking care of the patients, because Martin and I would have a different relationship with our patients because it would be on a longer longitudinal pattern. How does that bond for you work as a hospitalist?
Well, it is really a privilege to be able to be a hospitalist. We are meeting people for a snapshot of their life, and they also don't feel well.
Yeah.
Then, we ask them, what brings you in today? And sometimes they can barely even breathe and explain it. And you have to still understand who this human is as a person, where they came from, where they're trying to go. And so in some ways, we're air traffic controllers.
Yeah.
When I was young, I had asthma. I would get sick. Nobody likes being sick. You don't get to go to the party. You don't get to celebrate something. And similarly, my family members really recognize too that navigating the healthcare system when you don't feel well is all a challenge. So I think that it's always been ingrained that a patient is a person. And so I can't believe that I found a job where I had to talk to people and translate complex medical conditions and apply them and do shared decision making and help them feel better just by hearing them and listening and connecting them with the right next path.
Man, Heather, you touched on something that is deep within my soul. A patient isn't a patient with a diagnosis. They're a person who happens to be sick or struggling with something. And I think making sure we recognize the humanity in healthcare is so important. If we're not intentional about that, we can start to drift away from that. And so I'm grateful as a hospitalist leader here on campus that came out of your mouth, because that to me is everything.
Yeah. It seems like you've really found kind of your life legend, like what really brings you joy.
I love it.
Completely.
But it would be so hard for me to see those patients and then they leave, right?
Right.
You want them to be discharged, right? That's the ultimate goal. So do you ever find yourself wondering about kind of where they ended up or how they ended up?
Of course. Our emergency medicine colleagues, they get the extreme versions of it, right? People just very short moments. I think it's a balance too, in that it's also a burden to have that deep relationship for a long term. I feel, and this ongoing responsibility. So it's that balance of having empathy, but keeping it to where it's sustainable. And I think that it's also, if I'm taking care of patients in a very acute moment and know that I helped at that moment in their life, I can just kind of try to stay optimistic too.
Yeah.
And that kind of keeps me going, because being sick is really hard.
Yeah.
And that sort of, if I see, joy in challenging moments, that can at least bring me some joy.
Yeah, that joy is important, isn't it? There are things in life we take for granted, like going to the bathroom the regular way. All of a sudden, someone comes in with a diagnosis in their urologic system, how we go to the bathroom, a very basic thing we expect to do and not have an issue. You have to try to put the pieces back together in many ways, right?
Yeah, and it's not always easy.
No, I mean, because we can talk about urologic cancer and all this, but fundamentally, I mean, that's the big part. But even with a curative surgery or a surgery that extends the lifespan of a patient, the after effects are almost as important as, do you have can you use the bathroom, or do you create a new bladder? I mean, these are some crazy things. Talk a little bit about your life and how you work with patients on that.
Yeah, I think it's, everything that we do in medicine has some sort of side effect, some impact, something that might change how that person lives their next days. And I think in urology, that is one of the unique things, is that some of our most common cancers that we manage, in bladder cancer and prostate cancer, really leave, marks on someone's day-to-day life. Mm-hmm. And although we've got awesome technology, awesome improvement in techniques and ways to minimize some of those impacts, or maybe even to make things better for people who have a problem with those issues from the outset, the impact on someone's quality of life is right up there. And so I think that's why urology has been kind of early in some of the adoption of things like active surveillance, and realizing, not all cancers are the same. And sometimes we can keep someone safe, but spare them some of the side effects of treatment. And not everyone is a good patient for that. There's different, criteria, but there's options. And so for me, I think it's what Heather mentioned earlier, of seeing someone as a person, meeting them where they are, understanding their values, their goals, and what's important to their day-to-day life, and understanding kind of what things are at risk, and helping them with that decision process of, figuring out their priorities, and then trying to come up with a plan that works and that will work for them in the long run.
That must be some heavy conversations, because it's not just... it's really kind of trying to protect their dignity. How do you have some of those maybe more difficult conversations?
I think luckily people have some basic understanding, because some of these are common enough that they, even if they have either gotten some misinformation or have heard some old wives' tales, they at least have some understanding of kind of what we're talking about.
What are some of those wives' tales?
Well, I think that just some of the side effects in terms of urinary leakage after any prostate cancer treatment. I mean, there's always, some truth to things, but it's not always the same degree of a problem. And the other part is just practice. I think that we get used to meeting someone and kind of diving right into it, and kind of figuring out how to become a pretty close confidant to patients. And so I think that's part of it too.
Yeah, I've seen surgeons who deal with potentially awkward conversations, those that can just take away the stigma of the conversation and just say, hey, this is a situation, talk about erectile dysfunction. I mean, there's all this sort of stuff, right? But if you just normalize it in a way, it takes some of that uncomfortableness out of it. And, so folks like you who do it and do it well really put a patient at ease, I think, so that they feel comfortable talking about those concerns too.
Yeah.
Yeah, I think that's what a lot of what drove me to it, or brought me to urology, was I felt just comfortable. I really liked sitting with patients and having that relationship, and realized that I didn't have much of a problem myself having those conversations. And I think that lends to breaking those barriers.
I want to know how interesting your either dinner table discussions are, or maybe it's the bedtime discussions. I don't know what they look like, but I know that you guys are very similar to the Kennedys, and that you like to have a dinner time conversation with the girls involved, right? So you involve them maybe in some of the scientific discussions, or how does that work?
I think we try to leave some of the bare bones medicine off of the dinner table if we can.
Yeah.
But I would say they definitely know what we do, and they definitely have some interest, but then sometimes immediate disinterest in what we do.
Truly. I mean, right. And some of it's just basic connecting the dots. So their friend breaks an arm and they have questions about it. And so you start kind of going through all of that, and it can be sort of stressful, explaining them when I've had a hard day, just for context. I don't necessarily want to go through all the details, especially to a kid, but also they've had a hard day. And so it's it's trying to find the balance of like, is it like a competition of who had the worst day? Like that doesn't get anywhere.
Yeah, right.
And so we kind of have to also create space for each other, but also for ourselves to kind of let it out and say, today was hard. And how do I work through that in a way that your support system, even if it's just your kid, can still support you and connect?
You know, one of the things, my wife's in mental health and not a physician. I would almost think having two physicians come home at the dinner table would almost be a hard sort of scenario to escape from work because you're both talking. So I mean, I think
laugh because it's so true.
there almost has to be some intentionality to say, okay, let's talk about life or some other subject than what's all consuming in our lives otherwise.
I mean, remember early when we were like, I was a resident, maybe you were a student or a resident by then, and we'd have to just be like, all right, we're cutting it off at like 10 minutes or something. Because literally, because it's also how much can you give and space. And also at some point, it's not healthy to just say, you know, wow, I forgot this, or I did this, or then this happened or something. Obviously HIPAA compliant.
Yeah, right, of course. Because you guys are like kind of comparing notes, or are you guys just kind of like
debriefing on the day and just reflecting and because we're growing, right? We grew together. We're still growing together of becoming a doctor.
Yeah, I mean, I think we like to say we could talk or not talk for hours, and you know, we could talk or not talk about medicine for hours, and we do have to sometimes, as you said, intentionally kind of say, you know what? Let's focus on something else. There's a lot of other stuff going on in the world and with our kids' lives and with our family and with our own lives that is not medicine. And definitely some intentionality of focusing on that is helpful. And for our kids, probably really, really helpful.
Yes.
Yeah,
Yes.
absolutely. Yeah, I think there is such a balance. I don't know. I really find it fascinating, you know, obviously HIPAA compliant as well when my husband tells me about some of his emergency medicine cases because they stick with me. I struggle to let go of the patient and I wonder how that ended up, right? And I'm so impressed that you guys you're able to kind of give that space to, okay, you know, we have this different compartment that we need to be in this role, and that's parents. And so we're going to talk about dance, or we're going to talk about friendship bracelet making, or whatever it is that kind of decompresses probably your day too.
Absolutely. And I think that it's having kids, they get a winter break, they have a summer. Doctoring, you don't really do that. And so that has also created a rhythm throughout the year even to reflect and say, you know, how have things gone? Because you also need to ultimately have that space to decompress a little bit too.
How do you manage the winter breaks and the summer breaks with the schedule that you guys have?
Well, the short answer is, you know, my schedule is in like sort of shift work. And so a lot of it is flexibility in my schedule, days off on your schedule, and a village, family, friends.
And I would say I come, you know, from a department that I think it's been a family-based department, you know, from what I can tell from day one. And so I think not just the department culture, but just my colleagues as people, we all want each other to be able to find this balance. And so having some time, being able to set aside some time to be with family, or, you know, people covering for each other on a certain day if we have to get away. There's a lot of flexibility built into just who I work with. And so that's been helpful. And then a lot of master planning is the other part of it.
Some architecture.
Yeah. Here's a question I haven't asked before. Just out of curiosity, if you weren't a doctor, what would you have done? Or was this what you were going to do since you were a young boy?
Well, I would say in high school, I went through a phase. I mean, journalism I took very seriously when I was in high school, but I went through a few different things: journalist, architect, photographer. But really, what it probably would have come down to is either teacher or a cook, a chef.
A chef.
I get the teacher because we're educators at heart. The chef,
The other white coat.
Yeah.
I mean,
the other white coat. That's brilliant.
And surgery to me is very similar, I imagine, to being a chef.
Yeah,
to putting it all together.
Some improv
Yes.
plan, but some improv, so it works out.
So, I mean, can I come over and have dinner?
Yeah,
I
what
mean,
are we
is that-
talking
is that
about
kind of
here?
how you are? Or
yeah,
what?
yeah. That's, I do a lot of cooking at home.
That's brilliant.
The girls help.
Yeah, and this was a gift years ago. I do have 2 white coats because one of them is a chef's jacket, but I don't really wear that at home.
I wish you had it right now.
But yeah, so I think probably
That's awesome.
Probably teacher, but the chef part because that's a passion too.
Yeah. We couldn't let this opportunity go by tonight without asking a question that we can't ask in our other guests. When we're talking to a physician across the table, we get to hear from their perspective about their life and how they recharge their batteries and what's their philosophy and things like this. But I don't ever get to ask the spouse about their husband or wife. So, Heather, I would love to understand, in your words, the Mr. Dr. Hofmann.
I'm not supposed to cry. This is so sweet to be able to sit and talk to you about all this. But Martin is so patient. He is such a good listener. He creates that space, which for me, I'm listening to people all day. I'm getting asked questions all day. But as the evening goes on, you're still a human, and sometimes you just need to not be asked a bunch of questions and just have that space. So for me, he's just an incredible listener, and he's so patient. And then I also, if I have questions, he just seems to have an answer that's so me, right? Of gosh, I have multiple treatment options for my patients. Where do I go? How should I go about this? He's like, well, you just do this. But it's not about patient care. It's just about life. And so I so appreciate that he's the opposite of me sometimes.
And vice versa now. Tell us a little bit about, what did you say, Mrs. Dr. Hoff?
Yes.
Well, I would say those are very kind words. And it may have to do with the personalities that kind of drive into, specialties do kind of have some degree of personality differences. And I would say Heather has a remarkable knack for planning. And it really obviously can keep things moving forward on a household perspective. But even when it comes to projects for the kids that they just get excited about, she can come up with a lot of these wonderful ideas. Whereas I feel like a lot of what I do is, okay, I'm going to cook this for dinner tonight. I'm going to put that away. I'm going to move the trash out. And it's kind of day-to-day tasks. And she's got kind of the 30,000-foot view, which maybe is kind of similar to an internist or a hospitalist of kind of making sure, okay, guys, that's great for that problem, but let's zoom out here. And so she has just a remarkable ability to kind of keep perspective and think about the days, weeks, months ahead. And I think the kids just really gravitate and jump on that because they know there's going to be something fun to do.
Oh,
cool.
Mom's always got a good plan.
Yeah. No, this has been a treat to have both of you on our Evening Rounds podcast. As I do with every Evening Rounds podcast, I talk about the intentionality of our name, the title. In fact, I'm very touched with your daughters making a bracelet, Evening Rounds. When you hear the term Evening Rounds, I'll start with you, Heather. What does it mean to you?
Sure. Well, as a hospitalist, that's easy. That's the shift change. That's the transition. That's the what just happened in the day and reflecting on that. We sort of say tucking our patients in for the evening and preparing them for the next day. But it's also helping our nurses and have what they need and triple checking your work to make sure if you're missing anything, it's that checkpoint, almost like in a relay race of passing the baton. So to me, it's that transition time.
I like that.
I've
never heard
We haven't had that, have we?
passing the baton.
Yeah.
Is really a beautiful way
That's brilliant.
to talk about it.
And Martin, how about you?
Yeah. So I think I think the medicine side and the life side kind of communicate together for me. As a surgeon, sometimes you're walking out of the OR, who knows what time of the evening it is. And so you're usually catching up on some of those things that happen over the course of the day that maybe you were kind of a little bit attuned to, but not really dealing with face on. And at home, we actually kind of do a version of this at the dinner table, which we referenced earlier. And we kind of go around the table, usually youngest to oldest, and say, what was your favorite thing that happened today? Or maybe what was the worst thing that happened today? What was the toughest thing? And I think part of that is just understanding, all right, what can we learn from today and apply that to tomorrow, hopefully for a better tomorrow. And so I think that's what I think about with evening rounds.
Oh, I love that. That's beautiful. What a cool way to decompress and to also get to know each other better.
Yeah.
Yeah.
Those are 2 taglines I think we're going to have to incorporate.
There's more bracelets.
It's been a real treat and really appreciate you spending your time with us.
Yeah. Thank you both.
Likewise. Thank you.
Thank you.
A special thanks to the sponsor of Evening Rounds, La Loma, who has provided banking services to the Loma Linda community since 1955. Their support helps us continue bringing you episodes focused on health, story, and mission.